My name is Lindsay Mullins, and my research proposal presentation is on mental health care here in Utah. Mental health care is both difficult to access and difficult to afford for many in need in Utah. All over the United States, there is a lack of mental health care professionals. In Utah especially, there are not enough to meet the need. At the offices that do offer this care, much of it is unaffordable for many. Co-pays for these visits with psychiatrists or therapists are high, and some of them may not have insurance to even cover some of the appointments. This health care is necessary to all of those who suffer from mental health issues, including major depressive disorder, postpartum depression, generalized anxiety disorder, post-traumatic stress disorder, and many, many more. I personally know many people affected by both of these issues, whether it be their financial struggles or healthcare professional struggles. This topic is interesting to me because of all the family and friends that I have that have been negatively affected by either the cost of their mental health care or finding the providers that they need here in Utah. Some of my research questions include, why is mental health care so expensive? And how many healthcare professionals are needed versus how many we have now? And here is some of the background of Utah's healthcare system. Utah Department of Health has known about their heightened rates of suicide, especially in young adult males, since the early 1990s. Since this knowledge was made public, Utah has attempted multiple different programs to aid those with mental health issues, especially those struggling with those suicidal thoughts and behaviors. So why aren't they working? These programs don't help with the real problems in seeking and receiving treatment for these mental health issues, the high costs, and the lack of providers. There are many contributing factors that make mental health care expensive. For medication, pharmaceutical companies rack up the prices. Without insurance, these prices can be outrageous. With insurance, there is likely to be a smaller charge, but can still be pretty pricey. For appointments with these medical professionals, many are seen by insurance as specialty appointments. As it is expensive to go see a specialist for physical health, it is also expensive for mental health. Here are some of the general costs of these appointments. According to the University of Utah Health, without insurance, the cost of a psychiatric diagnostic interview or a diagnosis from a psychiatrist is $315.70 without insurance. A 30-minute session of psychotherapy without insurance is $115.90. And a 60-minute session is $268.50. And psychotherapy is essentially just therapy for those with the mental illnesses. The costs of a therapy appointment and diagnosis at one of the leading hospitals in Utah is more than some make in a whole day. With insurance, that cost goes down to a copay because of the insurance based on the insurance the patient has. These copays can range depending on the policy. A patient that I interviewed says that his copay with insurance for his weekly one-on-one therapy sessions that are beneficial to his multiple mental disorders is $93. $93 a week adds up to $4,836 a year. In Utah, there are mental health providers in 27 out of the 29 counties. These providers are underrepresented in Utah County by 2.9%, Davis County by 5%, and Weber County by 1.8%. However, Salt Lake County is overrepresented by 11.1%. And this information is from Ms. Christensen in 2016 off of one of the Utah government websites. So maybe the issue isn't the amount of providers we have access to, but it's the cost of these visits. Along with these facts, I would like to go further in depth about the Utah Mental Health Initiative from the government. I would also like to research more what costs patients are dealing with in regards to their insurance and copays. I think it's beneficial to find out what percentage of Utah residents are dealing with these mental health issues and how many are actually receiving the help that they need. I'd also be interested to see what the current politicians in power are planning to do to improve the mental health care system in Utah in the future. Utah has made many changes and improvements in the past, but they have not significantly helped the suicide rate here or the costs of this care for their residents. For more secondary source information, I will use the Utah government websites to find more demographic information and also their plans for the future with mental health care. These sites have proven to be the most helpful in my research so far. And I also plan on interviewing a mental health patient living in Utah County, Utah. And these are the questions that I will use to interview them. Number 1 is, what behavioral hospital did you visit and for how long? Number 2, what is your diagnosis? Number 3, how often do you see a therapist? Number 4, how often do you see a psychiatrist? Number 5, what percentage does your insurance cover of these appointments if you have it? Number 6, when you first tried to find a mental health professional in Utah, how long did you wait on a wait list? Number 7, how do you feel like your mental health providers here have been compared to when you lived in any other state? I think these questions are important to ask because I feel like they're very direct in getting to the root of some of the issues that I've been talking about in my research questions. So it'll be good to have a primary source to be able to find out what exactly they have had issues with, just with their mental health care journey. These issues are important in the state of Utah because of how many people are affected by them. Many we cannot see the effects of because they just suffer in silence. Many we do see the effects of because their mental illness has taken their life. This research can educate those around me to better understand the costs and providers here in Utah and possibly the best course of action to take for their own mental health and getting involved with our government. I would like to piece together all of the contributing factors to the mental health crisis we have here to figure out how we can help. I hope that this can at least help one other person to understand the issue and raise awareness in the future however possible. My research timeline for the completion is right here, and by February 15th, I would like to have all of my research questions finished. By the 19th, I would like to have my source evaluation. By the 28th, my interviews with primary sources using those interview questions. By the 29th, the annotated bibliography is due. March 7th, the outline of the rhetorical think piece is due. March 14th, the final draft of the rhetorical think piece is due. And then on April 30th, the final reflection essay is due.